I have the pleasure of introducing, my apologies, Bethany Meyers, who has been practicing as a clinical social worker in communities in Connecticut, Washington, D.C., Indiana, Colorado, and now in the greater Boston area. Bethany is a clinical social worker on the palliative care consult team at Massachusetts General Hospital. In addition to this role, Bethany serves as the bereavement coordinator for the Division of Palliative Care and Geriatric Medicine at NGH and the social work and spiritual care lead. Bethany is interprofessional faculty through the Center for Palliative Care at Harvard Medical School, teaching as part of the practical aspects of palliative care and palliative care education and practice courses. She has completed the certificate in palliative and end-of-life care at Smith College School of Social Work and is certified as an advanced palliative and hospice social worker. Bethany received her Master of Social Work from the University of Connecticut, specializing in community organizing and macro-level social work. She also completed a Master's of Divinity at Yale University and ordained in the Episcopal Church. Bethany is passionate about supporting patients and their families experiencing serious illness. So I will now turn it over to Bethany. Thank you so much.
All right. Hi, everybody. Thank you, Todd, for that very generous introduction. I'm going to share my screen and pull up a PowerPoint presentation to get us started. And please let me know if you can't see that well. Can you see that okay? Todd, does that look okay? Great. All right. Well, so as I'm so grateful to all of you for being so generous with your time to be here tonight. And I really do hope that we will put the conversation in Conversations with Caregivers. I hope to provide a bit of a framework and some kind of grounding information in talking about grief and loss, and then really hope that we will have an opportunity to have a really robust discussion following the kind of formal presentation where we can really learn from one another. So that's my hope for the evening. So the title of the talk that I will give tonight is called Grief and Loss, the Expected Surprise of Caregiving. And I think it's really just speaks to the ways that we know that grief and loss is part of the caregiving experience. And even though we know that, it can still be surprising in any number of ways. So while it's expected, it can still be a surprise. So I hope that we'll kind of talk about that some this evening. So our learning objectives that I'm hopeful that we will address together this evening is to really try to gain an understanding of grief and bereavement, and then particularly kind of move after kind of those foundational learnings together into a bit of a conversation about how the loss experience is really unique for the experience of a caregiver. And then we'll transition into a time of talking about tools and some preparation that hopefully can be useful starting now to really kind of help with this process of grief and loss and bereavement. So we'll just kind of launch right in with getting a shared understanding of kind of what grief is. So really what we know is that death of a loved one is really one of the most powerful stressors in everyday life. And it's something that is kind of a shared human experience. And one of the things that kind of distinguishes the way that we think about grief from this kind of shared human experience that everyone experiences of the loss or death of someone is that it's really about kind of the anguish that's experienced after a significant loss. It's usually around the death of a person, but it is really about this kind of psychological distress that someone can experience, separation anxiety, confusion, yearning, this kind of deep kind of yearning sense that someone has that might also kind of put them into a certain space about how they're thinking not only about the present time, but also about the future. It might give them a sense of kind of apprehension about the future. And so we know that people who are bereaved, people who have experienced this kind of death or loss, are at an increased risk of physical and psychological problems. And so just for kind of thinking about some of the numbers, in 2022, there were over 3 million deaths that occurred in the United States. That's according to the Center for Disease Control. And it's important to remember that the majority of people will experience what's called really a kind of normal grieving process. And we'll get into that a little bit more, but this kind of normal grieving process where the intensity will lessen over time. And there's really a percentage, about 10% of people that will experience a reaction to that grief that's going to require professional intervention. So again, of those 3 million people, just about 10% are people that are going to require some sort of professional intervention. There's a lot of different dynamics and factors that we'll talk about that go into impact why this is true. But one of the things that we do know is that the location of death can really have an impact on how someone kind of experiences that loss event. And we know that there's evidence that shows that a hospital death that can sometimes feel like one is unprepared for has an impact in someone's grief experience versus someone who's able to be home with services and supports like hospice provides. And so, as we mentioned before, that grief can kind of impact all different domains of life, behaviorally, spiritually, personally, emotionally, mentally, kind of all those domains really get impacted by grief. And again, grief is really a normal response to loss. If that's one of the things that you hear and take away from this evening, I hope you'll remember that grief is really a normal response to loss. And it does require this kind of period of adjustment to kind of not only the loss itself, but then kind of what comes after that. And so we talk about acute grief, which is really that kind of period of time immediately following the loss, where someone, again, is expected to have a normal reaction to that loss. But we would expect to see that reaction to kind of lessen or improve over time. And usually there's a period of time where that intensity is thought to subside, usually by about 6 months or between the 6-month to 12-month mark, where really, that intensity is thought to subside. And I know that really does sound like a long period of time, but I just want to kind of normalize that there really is, again, this kind of period of adjustment that we would expect to see as kind of this a longer period of time. Now, you might have heard the expression, whether clinically or kind of thrown around, about kind of complicated grief. The language that clinicians are using that has changed from complicated bereavement or complicated grief is now what we would call prolonged grief disorder. And I actually think that's kind of helpful because it makes us think about kind of a time frame that is, again, prolonged and not just about the experience of the grief. And so it helps us to remember that someone could experience this prolonged grief disorder that would not actually be able to be diagnosed according to the manual for diagnosing that clinicians or providers would be using, that is not something that would be able to be diagnosed for at least 6 to 12 months, usually closer to 12 months. And so that is really a persistent grief that is really kind of disabling in multiple domains of life, where one is not able to function across multiple domains. And we could get into the kind of specifics of that, but it's really, again, important to remember that 10% of people there's only about a 10% the 10% chance of people who are going to require that professional intervention. And so this kind of prolonged grief disorder that will require intensive interventions is really something that is more expected for about 10%, but 90% of people are not going to require professional intervention for, again, this really normal experience that we as human beings will have. And so one of the things to remember is that the strength of the attachment bond between the deceased and the bereaved is really connected to that grief experience, which is, I think, really where the caregiving experience comes in and is really helpful for us to think about. And so the important thing to, of course, remember is that grief is highly individualized. And we'll talk about that in lots of different ways. But it's important to remember that no two people experience grief in the same way. And those two people might be grieving the same person, but no two people are going to experience that grief in the same way because it is so highly individualized. And I think one of the things that can sometimes feel kind of overwhelming about the prospect of grief is that we don't actually know how we're going to respond to it until it's happening. And so we'll talk tonight about how there are some things that are kind of predictive ways that we can think about things like risk factors, ways that we might think about protective factors, things that kind of can help with a bereavement experience. But all in all, it really is something that's so highly individualized, and we don't exactly know what it will be like for us, but there are certain things that we can do to try to prepare. So here are just some examples of some risk factors that we think about from a bereavement risk perspective. And there are some things that, that feel like they're just kind of part of what is, right? That we don't have a lot of agency or ability to change. But as you kind of look through this list, I would encourage you to think about some of the ways that we can kind of conceptualize these risk factors. So we know that people who have a history of mental health diagnoses, a lower socioeconomic status is typically a higher risk factor. That's usually related to someone's ability to be able to access different supports and resources, the kind of social determinants of health we call, where someone has certain kind of indicators across various domains of life, whether it's their living situation, their income source, their racial and ethnic backgrounds, and all of those different things can impact someone's risk factor for how they will experience a grief or bereavement period. If someone has a lack of support system, if there's a history of substance use, past or current, the cause of death can also be a risk factor, particularly a traumatic death or one for which there's no ability to kind of be prepared. Those can often be a risk factor for a more complicated bereavement experience. Lack of preparation for death, those kind of go together, but again, if it's kind of an unexpected time where someone is not able to make, some of the more kind of practical preparations as well as some of the emotional or spiritual preparations. If someone had more of a dependent relationship with the deceased, whether that is one where from an emotional or financial, there's lots of ways that we can be dependent upon one another from a physical caregiving kind of perspective. We know that that also impacts someone's risk in terms of bereavement outcomes. Conflict or unresolved issues with the deceased can certainly be a risk factor. Relational factors, coping styles, if it's someone who is not feeling particularly either well connected to the deceased or to themselves, we can see that as being a risk factor. If someone is having a lot of different losses or life transitions at the same time that the loss is happening, that can certainly put someone at higher risk. And what's the kind of nature of the relationship to the deceased? This is where we see caregiving can come in for sure, that people who have a really highly developed relationship with the deceased, that can put them at a higher risk. And then the kind of role strain or role over or the overload can certainly put someone at a higher risk for a more prolonged grief process. So I don't know about you, and I can't see everybody, but I know that sometimes visually is really helpful for me to think about grief. And so this is Sue Morris, who is a colleague here in the greater Boston area. She runs the bereavement program at the Dana-Farber. She has this really helpful image that I think is really helps me to kind of wrap my brain around some of this a little bit. And you can see that there's this kind of what she calls the wave-like pattern of grief. And so you can see that kind of closer to the death event itself, that there's a lot more kind of intensity and a lot more kind of variability, that kind of up and down, up and down. And then you see as time kind of moves on, you kind of follow the arrow across, that intensity kind of, seems to kind of even out a little bit more with these, where the dotted parts are called these trigger waves. So that might be something that, kind of causes a spike where you might kind of revert to some of those more challenging experiences, or be kind of reminded of the loss in a way. So you can see as you get closer to the first anniversary, certainly you would expect to see some kind of trigger waves happening then. But I think it's really kind of underscores that it's not this kind of, flat dynamic, or that it's this like where it starts really intense and then it's just going to drop off and you're going to get to the end where it feels like everything's normal again. But really there's this kind of process that happens, and really the thing that leads to some of these improvement is really time. And that amount of time is going to be different for every person. Another visual that I like is the idea of how we cope with loss, and that there's this kind of oscillation that happens. This is called the dual process model, and it's about kind of this period of adjustment, which they're calling this restoration orientation, and then this kind of loss orientation, where people kind of move back and forth between feeling like, okay, I've got energy, I'm going to do some new things, I'm feeling a bit more distracted, and then you kind of oscillate back to, oh, I feel like an intrusion of that kind of grief experience, or today is really a hard day for me. Maybe this was the anniversary of when I first met my partner, or there's something that's kind of causing one of those trigger waves, and that kind of pulls you back and forth between these two experiences. And so I think it's helpful again to remember that we're not seeing just kind of a consistent straight line kind of pattern, that we're seeing this kind of back and forth, which I think it's helpful to remember. Now, this is an image that I actually really like, because I like pictures, I like images. I like to think about the different ways that we can imagine the landscape of our kind of interior life. And I think there are lots of little nuggets in this single image. And just so you know, we will make these slides available to you, so don't feel like you have to try to commit everything to memory. But one of the things that I think is really helpful about this, it's just the different ways that we experience, again, that kind of landscape is ever changing. So you can see these kinds of, grief landmines that are in the valley of the unexpected, right? But then you also have this kind of river of love that flows through the middle and kind of takes you to this cave of safekeeping. You see the boat of kindness that's making its way into the heart. And then I love the little lens where it's looking, the beauty lookout, right? Where you kind of have to remember that you need to be intentional and attuned to the fact that you might actually have to be looking for the beauty that's not just going to occur to you, because you might be in those fog banks of the future. So I like the idea of how we try to give language to things that kind of feel almost unexplainable sometimes. So this is just something that, again, I think helps me to visualize. So now I want to kind of talk a little bit, particularly about caregiving and the loss experience as a unique experience, and why I think this is such an important conversation for us to be having together, along with other folks that are present here from the Caregiver Support Program and from the Dementia Care Collaborative, because these are really important conversations for us to have together about how we can kind of share our mutual learnings and expertise with one another. So just some brief information on caregiving, which I know that we don't need to spend too much time on, because most of you are living this reality. But there's over 11 million people who are here in this country who are estimated to be providing unpaid care to people with Alzheimer's disease and related dementias. Greater than 50% of them are adult children who are caring for a patient. And this is data from the Alzheimer's Association back in 2021. So we can obviously get some more updated information, but at that time, which was kind of right at the end of the pandemic, these were the figures that we were looking at. So about 25% of adult children are in that sandwich generation, which I know gets a lot of press, but about the idea that there are people who are caring for a parent and also caring for their own children at the same time. They're kind of in that sandwich in that middle. And I'll be interested if that kind of resonates for any of you here tonight. And then a lot of times, caregivers are also working full time in addition to providing the care to their family member. About 66% of family caregivers live in the community with the person with dementia. And so they're actually kind of in a shared living environment. And there are obviously a lot of different family roles that can be part of the kind of group of people providing care. That could be spouses or partners, grandchildren, siblings or friends. There are a lot of different kinds of interpersonal relationships that people are engaged in who are providing care to people in our communities. And then about 2/3 of family caregivers are women. And it's important to really underscore the fact that caregivers of color provide more care and receive less help than their white counterparts. And there's lots of reasons for that, but it's really underscores some of what we had talked about earlier about how there are different dynamics at play, but really caregivers of color do bear a higher burden in the kind of caregiving realm. Although I will say that some of the research does show that the caregivers of color will articulate a higher level of satisfaction with their role of caregiving, even though they do are studied to be receiving less help than the white counterparts. And then also the role of being a spousal caregiver, where that they're being asked to kind of have this dual role of being the kind of supportive partner while also doing that caregiving demand. And I think we know that along a lot of different roles, that there really are that kind of dual role that caregivers find themselves in. So I don't want you to think that it's only risk factors that we're going to be talking about, but there really are protective factors that we know help people to be kind of insulated, to have some protection. That's why we call them protective factors from some of those risk factors that we talked about. So really having a support network is really important. Establish mental health support, and this is for people who have a history of mental health challenges or who don't, but knowing where to turn to or having kind of that go-to resource that you would be able to utilize is a really important protective factor. Hospice utilization, as we mentioned earlier, the location of death really does have a big impact on how someone will experience grief. And we know that there's a higher level of protection for a poor bereavement outcome for people whose family member is enrolled in hospice. And I will say that I think part of that does have to do with the bereavement services and support that hospice does provide for patients and families for even up to 13 months following the death. But also kind of further down, you can see satisfaction with symptom control prior to death. And certainly as a palliative care social worker, that's something that's of great importance to me and to our team about how we can really try to help patients have good symptom and pain control, and that also does impact those that are at the bedside with that person. And then when we talk about spirituality, if someone has a high level of spirituality or has connection to various religious communities or religious rituals and spiritual traditions, that we know that to be a protective factor around poor bereavement outcomes. And then shared decision-making around end of life. If someone feels like they are able to participate in the decisions and feel like they got support, it doesn't say independent decision-making, but shared decision-making. So people who feel like they have a good sense of how they can represent those desires of some of their family member, while also feeling supported by maybe a medical team, other people within the family system, that we know that that does have a positive impact for bereavement outcomes. Advanced care planning, so trying to be organized and kind of have, as people always say, right, I have to get my affairs in order. Having your affairs in order is something that does make a difference, as does early preparation, which I hope is kind of part of what we're trying to endeavor together tonight, is the ways that we can kind of think together about preparing and some of those tools and preparation that's really going to be helpful kind of in as time kind of moves forward, as it tends to do. Adaptive psychological well-being, so the ways that we're able to have insight, develop some of those senses of kind of what works for us, what doesn't work for us, and then kind of take new information as maybe we're in a new position, or have changes to our systems or those relationships around us, and then how we are adapting or making changes once we integrate that new information. And then secure attachment styles. So people who have that ability to have a sense of like permanent object relations, the way that you can relate to someone from a sense of security as opposed to a sense of loss or detachment. So we know that caregivers are particularly a high risk group for grief and depression after death or loss. And there's lots of reasons why this is true. And again, we're going to get to some of the parts where I think we can really talk together about how to try to mitigate those risks as much as possible. But some of the contributing factors to that is really that, caregivers can sometimes be experiencing their own parallel aging or illness experience. And what we know is that caregivers tend to neglect those needs for the need of the person that they're providing care for. So that will kind of continue to kind of be put on a back burner, back burner, back burner. And a lot of times, those kind of competing needs become really challenging. And we know that caregivers tend to prioritize the needs of the person that they're providing care for. So there's all kinds of pressures. And again, I don't need to be telling you all this as caregivers, but you have the pressure of trying to keep the family member safe, the financial realities that are part of maybe, providing care, as well as also trying to work simultaneously, and what that does to your ability to be present and to have just, time as kind of your greatest commodity that just gets is so split, right? That there's so many demands on one's time that the financial realities can become quite stark very quickly. Medical appointments, then the kind of unpredictability that there's not, that we all know that folks who are living with cognitive impairment, or people who are providing care for people maybe who have chronic illness, that their needs and their abilities change over time. So just when you kind of think that you're reaching a place where you kind of are understanding, you kind of have a system going, that there could be some change that happens, and now that person's no longer able to dress themselves. And so now you're kind of back in a kind of catch-up mode of trying to figure out how to continue to, again, keep that person safe and provide the care that they need. And then there can be these competing responsibilities that really leave the caregiver feeling like, I'm just not doing anything well, right? I'm not doing my job well. I'm not taking care of my family member well. Maybe I'm also trying to care for my own family. And so you're kind of left in that middle place of just feeling like you're not really doing anything well at all. And then certainly the loss can be experienced multiple times. And we'll talk about that in the kind of next section about kind of grief and loss as it uniquely applies to caregivers. But really, there's that kind of sense of loss that happens kind of at the time of that diagnostic disclosure. And then you've got these kind of multiple losses, these kind of micro losses over time, as different kinds of things that might be, relational or personal or identity based, as those things kind of change or kind of fall away over time, that one can experience that loss kind of repeatedly, which is, again, one of the unique experiences for a caregiver. And then you've got kind of those multiple losses, and then at the time of death. So as those kind of add up together, that really makes for a pretty prolonged process of loss. And then research shows that caregivers can really proactively address the risk for negative post-bereavement outcomes. And that's really what I hope that we're trying to do together. So it's my hope to talk through some of these losses that are unique to caregivers as a way to really kind of provide some normalization and, again, a jumping off point for us to kind of talk about this in a way that will really help kind of inform that sense of preparedness and that sense of kind of agency and ability to kind of have a pathway forward, hopefully. So I think one of the things that is really important for us to spend some time on tonight is this idea of anticipatory grief. So we kind of talked about kind of grief writ large, right? How everybody kind of understands it, how we kind of hear it in popular culture. But really, this kind of idea of anticipatory loss is this feeling of loss that one experiences before the loss actually happens. And so it might be this kind of time of emotional preparation with that kind of future orientation thinking, but knowing that kind of where you are now, you're already anticipating a loss. And so you're grieving something that has not yet happened, but it is a very real emotional response that you're having. And again, I think one of the anticipatory grief responses that caregivers have is this loss of the former self of the person they're providing care for. That might also be for themselves too, because a lot of times, again, with those kind of competing identities, some things have to kind of fall away. And a lot of times our own self-understanding can be one of those things that falls away. But a lot of times it's kind of watching the person that you're providing care for, that they are no longer their former self. And so you're kind of, in a grief response around that. Again, as we kind of talked about earlier, there's those kinds of daily losses, that kind of multiple losses over time that you're already kind of anticipating, right? You're kind of in that space of where you're experiencing these losses. And then you also have eventually the end of lifetime. And so you're already anticipating what that grief experience will be like without actually knowing what it's going to be like. And I really want you to hear as well that, even though caregivers do experience the loss over time, it's not correlated with the duration of grief. So it's not that means that because of that, one is going to have a longer grief period, but it does mean that there are ways that we can do some preparation. And one of them is really using some of this language of being able to identify, okay, what I'm experiencing right now is actually some anticipatory grief. My person is still here, but I'm already kind of in this grief experience, and being able to acknowledge that can sometimes be really freeing for someone to provide some normalization, to say, okay, this is what I'm experiencing, and here's how I can put a label on that. And there can be a certain sense of kind of regaining some control and kind of knowing what you're dealing with. And again, some of this anticipatory grief can be related not only to what's happening with the person, if the person you're caring for has dementia, for example, it can be related to your own feelings of loss, the anticipatory grief that you're feeling around maybe some of the relational, personal, financial, emotional losses that you're experiencing. So that's anticipatory grief. One of the other kind of grief that we think about as being unique to caregivers, there are multiple experiences that can fit into these, but really, as caregivers, this is something that I think kind of is really important to articulate. So the next one I wanted to spend a little time talking about is this idea of disenfranchised grief. And so that's grief that is not acknowledged or validated by society, and or maybe your support system or your family system. And so this can really be, losses that someone feels like they almost have to grieve in private, or that they're kind of have to get over it quicker because it's not a real loss. It can leave you feeling like maybe you're not grieving correctly, or that you're not entitled to your grief. And a lot of times this can leave people feeling quite isolated, and that their loss has been minimized. And so, there are certain things like the loss of a pet, maybe if someone loses a job, but also certainly being a caregiver for someone with dementia or Alzheimer's. This is kind of a disenfranchised loss where you experience that, and people kind of from the outset will say, well, this is kind of something that you can kind of get over, right? Because the person is still with you. But again, some of that kind of grief process that someone would be experiencing can feel a bit disenfranchised because it's not as acknowledged. There are not necessarily rituals or kind of community ways to acknowledge and honor some of those losses that people have experienced. And so that can again lead to someone feeling quite isolated in their grief. And then another kind of way to think about loss that is unique to a caregiver is this idea of an ambiguous loss. And so that's really a loss that is kind of unresolved, unclear, or unconfirmed. So I would think, it can be kind of a physical loss as well as a psychological absence. And so some people talk about it if there's someone who is, let's say, a member of the military and they're on deployment, you might feel that kind of ambiguous loss. There was a lot of research done around like the Vietnam War era, where people left to go to war, and then some people for whom didn't return, or they didn't have a clear sense of kind of what happened. It left them with this kind of ambiguous loss because there was kind of this open-ended question. There wasn't this sense of closure. And sometimes as we think about that kind of physical absence of that ambiguous loss that a caregiver might feel, it might be that the person with dementia is still there physically, but who they are is no longer, who they were is no longer present to you in those moments. And same with that kind of psychological absence, that kind of that loss of the former self is something that you're really grieving, but it feels kind of ambiguous because someone is still kind of there, but kind of not there. And so there's no closure, but it's no one's fault really, but it's just a reality of this kind of ambiguous loss that you might be sitting with. And so caregivers can kind of be left with some of these pretty strong emotions of, of feeling guilt. Gosh, I wish it were over. Shame, feeling like they're already gone. Relief, I'm glad it's over. That kind of how unsettling that can be to feel that relief, which is a very real human emotion that a lot of caregivers articulate. That ambivalence, kind of what do I do now? That can leave someone feeling kind of, at a loss, kind of you're at the middle and you don't kind of know which way to go. Um, and so as we think about some of the other losses as well, these kinds of, again, relational, personal, identity-based, some of the intimacy losses that can certainly feel ambiguous and disenfranchised. The communication, when you lose the ability to talk with someone the way you could, you see their shared experiences and reminiscing. This is someone that you've had a long history with, and they can no longer kind of engage in some of the stories or kind of reminiscing about things, shared experiences that you had. That can be a real loss. Thinking about future planning, maybe the role within the family is changing. You used to be the house that hosted Thanksgiving every year, and now you're not able to do that, and that feels like a real loss, or that's a role that you're no longer able to kind of care for people in that way. And then, of course, the reordering of social relationships or schedules as things kind of, have to take other priority. And so I think that sometimes this kind of around grief, when these kind of loss experiences are happening, this kind of predictive thinking can be very enticing, right? I will be better by this date, almost like if we set our minds to it, it will be true. And so that can be really enticing, but that can certainly, you know, lead someone to feel like, again, their grief experience is that they're not doing it right, even when there's really no way to do it right. But there are certainly ways that we can try to be more supportive. And discouragement is expected. I thought I'd be better by now. I thought I was over feeling this way. But we really have to acknowledge that things aren't always predictable. Grief is not always predictable, but there are ways that we can try to add some of this support. Now, I don't think we can do a presentation on grief and loss without talking about Elizabeth Kubler-Ross, who is a very famous psychologist who in the 60s was doing some research around in the city of Chicago around kind of how patients with terminal illness were experiencing what she later termed these stages of grief, which are denial, anger, bargaining, depression, and acceptance. And so, and similar to the kind of wave-like pattern, I think it's really important that you hear clearly that this was not intended to be a linear experience for people who have survived the loss of someone. This was the experience that people who were experiencing the illness themselves, that she was able to kind of catalog over a period of time. But again, we're not expecting a kind of linear process. So if maybe one day someone is feeling anger and then they're the next day at bargaining and then they're at acceptance, that means that, okay, well, they're kind of through that process. So now they're going to be just fine. And you can see the graphic there, right? This idea of stages of grief that you kind of move through them. And then this person kind of did what their experience was like, where it's just kind of all over the map. You're feeling everything all the time. And really what we're looking for is for those symptoms and those experiences to really lessen over time, but they're certainly not going to be linear in nature. So I promised that we would spend some time talking about kind of trying to find some ways, some tools to help us prepare. And this was a quote that I heard at a presentation I had attended previously, and it just really speaks to, I think, what we're talking about tonight. It just seemed like everybody went to that expression, make sure you take good care of yourself. Well, really, I'm on call 24 hours a day. I'm dealing with something I'm clueless about. I don't know where it's going, how fast it's going, and my wife is disappearing. It's not an easy thing to navigate. So again, it's really important to remember that there is no right or wrong way to grieve. That I really hope that whether it's kind of this ambiguous loss or these grief and loss experiences that are happening over time, or actually at the end of life when the person you're providing care to has died, that you trust your own process and know that there's no right or wrong way. Grief can certainly leave someone feeling overwhelmed, a loss of control, that there are unrealistic expectations. Again, like, oh, I thought I'd be better by now, or you should be over this. You can be uncertain about your experience. Grief can, remember the fog of memory, right? Grief can really impact the way that we remember things, that we think about things, because it's going to affect every domain of life. It can certainly leave one feeling isolated, and certainly conflicting advice. I feel like everybody's got something to say about how to grieve correctly, but really just remember to trust your own process. And it's important, again, to remember that how someone reacts in the acute phase is not a predictor of how their long-term process will be. So if someone has a really intense experience at the moment of loss, doesn't necessarily mean that it's going to automatically kick into some sort of prolonged grief disorder. But really, it's not a predictor in that way. But what we want to do is really try to be vigilant about the things that we can do to help protect ourselves. And so we really want to try to fight against that isolation, try not to carry this experience alone, really try to lean on the people who get it. The power of shared experience, which I know is something that the Dementia Care Collaborative and the Caregiver Support Program really works to try to do, to try to help remind one another that there are other people who have this shared experience, and so that you're not alone in that experience. Again, practicing the power of articulation and validation. So trying to articulate some of what you might be experiencing. So just kind of speaking it into existence. So if you're having what you're wondering is maybe a grief response to, let's say, a diagnosis or a change in condition, actually labeling that not only for yourself, right, internally, but also externally. So other people kind of know what it is that you are experiencing. And that can be kind of validating to say, this is part of a process that I am going through, and there's nothing wrong with that. But I can put my finger on what it is so that I can know how to best help myself. It's really important, I think, also to look to accept help and support from others now. So before that kind of end of life period, it's really important to be able to identify people and relationships that you feel like you could rely on. Asking for help that's both formal and informal is really important. And it's important to be specific too. There are a lot of people that kind of will say, well, how can I help? But to be really specific, to say, you know what? We have to set out our trash on Thursdays, and it would be really helpful if you could come over and drag my bins to the sidewalk on Thursdays, right? Being specific so that people can know how to best help support you. Maybe exploring some of those family roles. Let's say that you're somebody who always hosted the Thanksgiving dinner, to actually ask to say what would be most helpful for you if you're no longer able to be in that role anymore. And learning about resources. Of course, as a clinical social worker, I'm quite biased to this, but really there are resources out there, and trying to connect with some of those resources is going to be really helpful. And I always advise people, if you call somebody and they say, you know what, we can't do that, to always ask that follow-up question to say, okay, I understand that you can't do that, but could you recommend somebody that could help me with this? Because a lot of times people that are within those networks know the resources kind of better than anyone else. I would say leaning into rituals and traditions, particularly from a religious or spiritual perspective. You might need to simplify or adapt rituals to meet the current circumstances or situations. It might be interesting to think about, if we're thinking from a kind of anticipatory grief or loss perspective, are there rituals that would help with loss acceptance now? Maybe you're feeling like you're having some grief, mourning the person, the former self of the person you're caring for. Is there some, ritual that would be helpful to kind of acknowledge that loss for yourself or for those in your community? Acknowledging the uncertainty that comes with this period of time is really important. I think that it's important to think about kind of this both and thinking. I think we get kind of caught in this either or kind of dichotomy. But if we think about kind of practicing both and thinking, where we think about who the person was in the past, who I was in the past, who I am in the present, knowing that I can both care for myself and I can care for the person that I'm caring for, this kind of both and instead of either or. Being honest, that's one of the really important things. Finding people that you can share the real truth with, especially if a trained professional checks in with you and asks how you're doing, what needs you have. Really be truthful. That's one of the things that we as clinicians and professionals, we want to try to be a resource, but if we don't know what's actually happening and what someone is experiencing, it's hard for us to be able to match what we're doing with what someone needs. Again, try to avoid that comparison that two people do not grieve the same. So don't look at someone else and say, well, look what they're already doing. I guess I should be doing that. Really try to avoid that comparison. Routines are going to be really helpful and important, no matter how small. That might be just one time in the morning. I have on down here a little further down, but to keep a journal. So maybe every morning you write down one thing. It can be one thing maybe you remember about the person that you were a caregiver for. It could be something that you're thinking about, but every day you try to keep and build on those small routines that are really going to help kind of guide you through time, because time kind of becomes a new thing in a lot of ways. Self-care and self-protection. I'm very conscious of the quote that was shared earlier about how everyone kind of says, take care of yourself. I think self-protection too is something that we don't talk about enough. That might be relationships that no longer serve you. There might be people that you find are requiring more from you than you're able to give, to try to draw up some boundaries for yourself around that. Thinking about decision-making strategies that you can use. Sometimes we feel like, okay, well, I have a to-do list. I'm going to do all these things. And you realize that all of them require decisions. And so maybe you group, I'm going to make 2 decisions today, and then the rest of these I'm going to go ahead and save for tomorrow, because 2 kind of feels like what I can do today. So think about some of those strategies that can leave you still with a sense of accomplishment, but without feeling too overwhelmed. Challenging some of that unhelpful thinking. Again, I would say later on down here, this kind of what if thought loop. No one is perfect. No one has done this perfectly. So trying not to kind of have that loop playing of I should have done this, I'm not doing this well, but to try to really challenge some of that unhelpful thinking. Thinking about some gradual exposure to difficult situations, ways that you can try to kind of think about things that might bring back some of those trigger waves that we had seen, and do kind of a gradual exposure to some of that that's kind of on your own terms, that can sometimes help with that sense of kind of coping and that kind of adaptive coping style that we talked about. So I guess in closing, I would say with each transition, don't expect to have all the answers right away. There's always going to be a reentry time. You have to work to establish new patterns. And there are a lot of skills that people have learned as caregivers, whether that's time management, whether that's resiliency, whether that's how to, change a bed with somebody lying in it, these kinds of skills that you learned as a caregiver, that you can still really leverage some of those skills at each transition point. And sometimes having a mantra like one day at a time can be really helpful, and you can find your own one that speaks to you. But try not to kind of get too caught up in this idea of time, because time itself, once you kind of are no longer needed in the same way, can become kind of overwhelming. And so think about how you can maybe try to stay more present oriented, but remember to take it slow, take time to honor your own strength, and find companions for the way as well. And this is an image that I really appreciate and have used many times in my clinical practice, but this idea that we sometimes believe that grief is going to shrink over time, right? So you look at the top kind of bottles, and grief is just going to get smaller and smaller. But in reality, what happens is that we grow around our grief. So these strengths, these new kind of capacities, these new things that we're able to take on kind of grows around this grief. And so if you see an image of a flower or something that is able to be cultivated and grow, that really that can kind of happen in and around the grief experience. So those are some of my references, and that is kind of the end of the formal presentation time. So I would love if we could transition to the discussion.